to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.
Good morning, everyone. Great to see you all on a sunny Saturday. Depends on where you live, though. Yeah, but this morning we are going back to a very important subject about our own health and well-being. And we're really delighted to have Dr. Joseph Omofuma, who will be presenting and taking your questions. Dr. Joe is no stranger to CAHN. He's actually CAHN's medical lead and clinical lead for our mental health service. And the other reason why we're very grateful for him sparing some time is today's his daughter's 11th birthday, but he still loves us. He loves the community. So he's given up his time. So Dr. Joe, we're grateful to you. And, the floor is yours to take us through, prolonged stress and its link to depression. Thanks, everyone. During the course of the morning and early afternoon, make sure you put your questions in the chat box. Welcome to those on YouTube and Facebook as well. And we hope you find the session engaging, interactive, and useful. Dr. Joe, over to you.
Thank you very much, Charles, for the kind introduction and for the warm words. Good afternoon, everybody. I hope you can all hear me okay. Thank you. That's great. It's always a pleasure to be here. Like Charles mentioned, I'm a GP with a special interest in mental health, and I'm part and parcel of what CAHN is doing. I'm grateful for the work that we are all putting our hands together to do to make sure that our community is healthier. So today we'll be revisiting a topic that we have actually sort of touched on in the past, and that is the issues around stress and also around depression. Today, specifically, I have been tasked with the responsibility of speaking on the subject of prolonged stress. Okay, and what I generally like to do is to define a few terms. So if for those of us who are new to the health hour, what we like to do is, what I like to do personally anyway, is to speak for about 15 or 20 minutes and allow enough time for us to be able to answer questions. So because sometimes in the questions, we're able to actually deal with the subject and the things that people are sort of thinking about. So please feel free to type in your questions. If you're on YouTube, you're on Facebook, or you're on Zoom, please feel free to do so. And we will do our best to answer the question. I am only one of many health professionals that serve CAHN, and so we'll be happy to be able to put heads together to help with that. Okay, I'm going to try and share my screen so that it is better for everyone to see. Okay. And I'll just make that. Let's go back a little bit on that. Okay, one more. What I really like to do is define things. So I think I'm a bit of a teacher. I like to, and apologies for those who may have heard similar presentations in the past, but I like to break it down to the nitty-gritty so that even as it were, whoever it is that has little knowledge of the subject can try to understand what we're talking about. So the first thing I want to do is to define mental health, which one of my favorite definitions, and there are several, but this is one of my favorite definitions, which is because it helps us to understand the subject today, a state of well-being in which an individual realizes his or her true potential and is able to cope with the normal stresses of life, work, and then productively make contributions to society. So mental health, in my opinion, is a state of well-being in which an individual realizes their true potential and they're able to cope with the normal stresses of work, life, and to productively contribute to society. Now, what is depression? Because we're looking at how prolonged stress affects depression. So let's just understand what depression is. So depression is a mood disorder, which causes a persistent feeling of sadness and loss of interest. So the key word there is persistent. If you lose your keys and you're upset, if you fail an exam and you're upset, if Man United lose and you're upset, that is not depression. Generally speaking, it's a state of being persistently sad. And most people agree between 4 to 6 weeks of that being consistently happening is what we then begin to talk about being depressed. So that's what is called clinical depression or a major depressive disorder. It generally affects how we think, how we feel, and how we behave. And unfortunately, depression can lead to a number of emotional and physical problems, including self-harm and suicide, which we'll probably be talking about, touching on slightly today. Stress in its own part is defined as a physical or mental emotional factor that causes bodily or mental tension. A physical, mental, or emotional factor that causes bodily or mental tension or pressure. It can be external or internal. It can be acute, such as a relationship breakup, pandemic, failed driving test, or chronic. Again, pandemic, which we didn't expect to last this long, physical abuse, bullying, financial struggles, or even racial discrimination. So talking about prolonged stress, when people experience the stress, there is the fight or flight response, which the body releases certain hormones that enables the body to be able to take action. For example, if you were to encounter a lion in the safari and you stood still, it may well be that you become food that day for the lion. So the body releases certain hormones that kick us into action and get us to start doing things. It's actually a protective mechanism. One of those such is adrenaline. So adrenaline sets in and you're able to do things that physically you may not be able to have been done before, or even run faster or think better. But what it does is that physically we become more challenged. So our heart rate increases, our breathing rate increases, just to enable us to be able to cope with that particular stressful reaction. And there have been cases of mothers whose children were trapped under the car, and within that short space of time, they received strength to be able to move the car because of adrenaline. It's a stress hormone. Now, you can imagine being in that state of heightened awakeness or arousal for prolonged periods of time. It becomes problematic because if your heart is beating fast all the time, if you're having a high breathing rate all the time, if you're mentally alert all the time, and you're not able to calm down, it then becomes counterproductive to your everyday living. And that's what stress does. It's a heightened state of arousal, and that's what prolonged stress, rather, where you begin to second guess things, where you begin to think about, oh, is there danger? And that is good if there's an immediate danger in front of you. Say there's a lion, there's a fire, somebody holding a gun to your head or a knife or something, and you need to react straight away. That's perfect. But if that then continues, it becomes problematic both mentally and physically. Mentally, your body is fatigued. There's only so much you can continue. There's only how long you can continue to be in that state of stress. And also, physically, it affects us. All the research points to the fact that the longer people are exposed to stress, the more it affects us physically and mentally, the longer you are exposed in that particular situation. As I was actually, and I know some of us may have heard me speak on this already, but I have some new juice for you. All right. I was reading some research that started with a Canadian psychiatrist about 40 years ago. This is very interesting, actually. Well, to me. They found out that 40 years ago, started this research and found out that prolonged stress can actually affect changes in your DNA. What do we mean? That means that people who have not experienced the same stress as their previous generation can begin to exhibit symptoms of those same kind of stress. When she initially brought it out, it was shoo-shooed and poo-pooed and said, what are you talking about? But research has gone on to show that Holocaust survivors and then their offspring that even grandchildren begin to exhibit symptoms of stress similar to those who were actually in the Holocaust. And they didn't stop there. They went to children of people who had been in the Vietnam War or who had been involved in the Vietnam situation. And they found out that generations going forward, those people began to exhibit symptoms. They were not in the same kind of situation that their grandparents were in, but they began to exhibit symptoms of those kind of stressful situations. The same thing with the big one, the racial issue. And children of slaves were found to be exhibiting symptoms of prolonged stress, even though they were no longer slaves. And so they began to look into it. And it's still a place of ongoing research. It's not yet quite complete, but they have seen changes where genes, it's called epigenetics, actually, if you want to look it up. I found it quite interesting. Epigenetics is now looking at how micro changes happen to our DNA, which makes us react in the same stressful situations that our forefathers had experienced in one way or the other. And it's a very interesting subject because I'm glad I was asked to talk about this because I'm actually teaching a series in our local church on breaking cycles of failure and defeat. And because you begin to wonder why certain individuals, certain types of people behave in the way that they do. And of course, the researchers have placed a very high premium and a very high responsibility on the environment. So the environment matters. The environment in which a child or a person growing up absolutely matters. But there is now evidence to show that there is some genetic aspects of it as well, where we can begin to experience stresses that have happened from time past. If there are questions, we'll talk about it. But let's look at some nitty-gritty, shall we? What are the signs? Because I talked about prolonged stress. I'm sorry, this slide is not great if you're looking at it at a computer. I didn't have time to edit this properly, but we'll make the slides available to anyone who wants it after the presentation. So signs of prolonged stress include anxiety, difficulty concentrating, decreased sex drive, lack of libido, erectile dysfunctions, disorganized thoughts, eating too much or too little, fatigue, feelings of helplessness. Now, I try to outline some of them because these symptoms, you will actually also find them in depression, and so we will try to link the two of them. Feelings of helplessness, frequent illness, infection, feeling out of control, headaches, indigestion, irritability, mood swings, recovery from illness slowly, trouble sleeping. Prolonged stress affects every single part of our body. It affects every organ, every system, and also affects us mentally. That's the point that I wanted to make from this. It affects every single part of us. And it's not something that we, the medical community, we've talked enough about, because this is actually, just like I said, it's only been in the last 40 years. Medicine has existed for thousands of years. But it's only in the last 40 or 50 years that a lot more research has come out about how this aspect of prolonged stress can affect us. And let me emphasize again that, people use the words stressed, depressed very loosely. People say, oh, I'm stressed. What makes you stressed? The guy in McDonald's did not put ketchup in with your order. See, that's not what we're talking about here. Or, you go to the supermarket and they don't have your favorite red dress that you wanted to order. That is not what we're talking about. Stress is a very real issue. It's a very real condition that begins to affect us mentally and then goes on to affect us physically. And as you can see from this slide, if you can actually see, it actually affects us in many different ways. For example, in the brain, there's brain fog, there's memory problems, there's lack of concentration. All of these things can affect how we relate with people on a day-to-day basis. Headaches, headaches is a very good one. Tension headaches, especially. Stress is a major factor. Hypertension, stress is a major factor in this. The same way that your body releases nice, good hormones when you feel good about yourself. Like if, for example, myself, if I eat carrot cake, lots of good endorphins are released and I feel very good. In the same way that your body releases good hormones when you feel happy, about things, when your son does well in school or your wife cooks your favorite meal. In the same way, when you are under pressure negatively, your body also releases these hormones, which then can be counterproductive if they stay too long in your system. This is why I said that all the research points that the longer you are in a stressful situation, the more that stress begins to affect us, and it causes changes in our body, it causes changes in our minds. Okay. If we go back one step here, you can look at and it's not totally conclusive, but if you look at this list here, the major causes of prolonged stress, I've tried to group them into groups that, we can easily sort of digest, if you like. But one of the things that tends to be very, very important for a lot of people, especially in my line of work where I see a lot of ill people, is long-term health conditions. All right. So when we mean long-term health conditions, we are talking about the asthmas, the diabetes, the hypertension, things like that. All the things that where you are chronically having to take a medication for a long period of time, that can definitely cause you stress. All right. Difficult relationship. Now, this is absolutely important. This is terribly important, especially because we're human beings. We're created to live in social groups, and we're supposed to live in social networks. So, in fact, in my opinion, apart from health problems, this ranks perhaps the highest in terms of what causes stress for a lot of people, especially in the younger people. I think this would be number one for a lot of the younger people. And when I mean young people, I'm talking about people under the age of 40 or 50. Generally, relationship difficulties are by far the number one. So problems with co-workers, the issues at work. A lot of times when we give sick notes out, when we sign people off sick, it's because they're having problems with their co-workers, problems with the boss, problems with the new manager. It's never really about chronic health problems or financial problems. It's that you can't get along with somebody. It's a toxic work environment, or it's a family member. The mom, I've not talked to one woman said, they've not talked to their mom for 20 odd years. Another one, whatever it is, family members, relationships, romantic relationships that have gone south and things like that. All these things can obviously cause prolonged stress because in human terms, those things are constantly in our faces. They're constantly there. They're the constant reminder. You can see the truth of the matter is, sometimes you can't really run away from your family because, especially if it's family members or somebody who you're romantically linked with, and maybe you've known them for a long time. And every time they're the friend of that person or a family member, that whole stress is brought on again onto that. The whole memory of it comes again, and it becomes an issue. Financial problems, we can't forget that. That's a big issue. Gambling is now recognized as, gambling addiction is now recognized as one of the fastest causes of mental health, especially in men. Gambling addiction, debts, sudden expenses, changes in your financial situation, losing a job, like what we found in the pandemic, people being laid off and things like that. Obviously, financial problems can be an issue, especially if you've got a lot of debt already, and then you find that things change. I've already talked about job-related stress, high-pressure environment, high-pressure job. a difficult work environment, or even being uncertain about relationship. That's really important. That it's a major factor. It's a really important factor in causing stress. Traumatic stressors. Now, this would involve everything else, sort of the war in Ukraine, racial bias, racism, people who have experienced war, combat exposure, PTSD, sexual or emotional abuse, physical abuse. All sorts of traumatic stresses can cause that, because the research that was done in terms of how stress is passed along in generations was actually looking at traumatic stresses. What are the things that can cause us stress that will then sort of taint the way we behave going forward? All right. Again, just to clarify, for those who may not have heard the talks in the past, symptoms of depression, if you look at this list and compare to causes of prolonged stress, there's quite a few similarities in there. So by and large, depression is defined as hopelessness, helplessness, and low mood. Those are the key areas: hopelessness, helplessness, and then low mood. Other things involve lack of interest in previously enjoyed activity, so the person just not interested anymore. Somebody asked a question, I think in one of the CAHN talks a few months ago, about especially young people. How do you know, how do you begin to suspect that young people, there's an issue with your young person if they suddenly want to lock themselves in the room? And I know teenagers do this all the time, but I'm just saying, have a high index of suspicion. If they suddenly want to lock themselves in the room, if they are no longer wanting to go out, if they're no longer interested in playing with their friends, please, as parents or as guardians, please investigate. They may be getting into depression. They may be being bullied. There might be something else going on. There's been a young lady in the area where I work, where it turns out that her stepfather was sexually abusing her, and that was what was causing the symptoms. So lack of interest in previously enjoyed activity is often a red flag for us when someone comes to us talking about, somebody who was previously happy-go-lucky, they were doing really well, everything, even dip in grades. If somebody's doing really well and they suddenly dip in grades, we then begin to think, what's going on here? We have to investigate. So when there's that sudden change in the way in behavior, it behooves us as healthcare professionals to investigate, and for those of us who are parents or guardians or friends and relatives to actually look into this further, because it could be a sign of imminent or beginning of depression. Memory lapses, tiredness, fatigue for no reason. Somebody said to me, I sleep 8 to 12 hours and I'm still tired. We sometimes have to investigate for depression. Some oversleeping, low sex drive, obviously self-harm and suicidal ideas are big ones. So what is the impact of prolonged stress on us? And what's the link here? So by and large, as I've already alluded to, and if you're following closely with what we've been saying, prolonged stress affects all the systems of the body. It affects every single part of us. It affects everything. So stress can lead to, I actually purposefully put this out there because I'm suspecting that somebody will ask the question. So it doesn't only just cause depression. It's not only linked heavily to depression, it's also linked to a number of other things. So stress can lead to anxiety disorders, generalized anxiety disorders, and I know we talked about this in January. If you want to go look that up on the CAHN website or on Facebook, we talked about how generalized anxiety disorders there. Autoimmune conditions such as lupus, thyroid, joint pains or arthritis, prolonged stress can do that. I know a lady who, due to prolonged stress, she had developed arthritis in her knees. And we're treating that. But that's what stress can do. It actually also decreases our immunity. It can lead to diabetes. It can lead to heart disease. It can cause high blood pressure or contribute to high blood pressure. Lack of sleep. Please be aware that all these things are what we call multifactorial conditions. So it's not only one thing that will cause high blood pressure. For example, just pick on high blood pressure just for the sake of an example. High blood pressure usually is genetic. There's a genetic component to it. There is a lifestyle component to it. There is a dietary component to it. But stress plays an important contributory factor in making that happen. Same thing with all of that. Diabetes as well. Lifestyle choices, diet contributes a great deal to who develops. And then, of course, your genetics also contributes to that. The good thing, however, is that if you know that there's certain things in your family, if you know that certain things run in your families, you can mitigate against that by choosing, by making better choices. Ab initio, right from the beginning, just make better choices in terms of your diet, make better choices in terms of your lifestyle. When I talk about lifestyle, I'm talking about smoking, alcohol, and recreational drug use, because all these things will affect our bodies. It will not only affect us physically, it will affect us mentally. There's such a thing as alcohol-induced dementia. Alcohol-induced, there's Korsakoff psychosis, of course, where due to alcohol, the person loses their memory and things like that. So we can see that. So I'm just saying that because when we're talking about prolonged stress, while it's an important factor, it's simply one of the main risk factors amongst a host of other things that can affect us and cause us to become unwell. Because many times people are looking for, how did I develop this? What happened here? Even your personality type, if you're a worrying type of person, it makes you more susceptible to stress. That then makes you more susceptible to anxiety and depression. So it's like a chain, a link of things that join together. And then if you then add lack of sleep or any of the other obesity, which in its own rights can then lead you to heart disease so you can see how all these things can sort of become interlinked. I think the important thing here is to try and ensure, if I'm going to start getting ahead of myself a little bit, is to try and make sure that we prevent stress. I think that's the most important thing. If there's no other take-home message here, stress is so bad that we need to find a way, or we need to find ways of making sure that we don't allow ourselves to get into that cycle of stress, that cycle, because it can then, one thing will always lead to the other. One thing will lead to the other. All right. Differential diagnosis, again, I like to say this because sometimes it's not all about stress and depression, because a lot of times depression has happened, depression has been diagnosed and they weren't really depressed. They were going through the menopause, or they had thyroid problems, or they had low vitamin D, B12, which can cause tiredness, which can cause a number of the symptoms that we've talked about, or indeed they may have an autoimmune condition like lupus, or it could be drug side effects, or it could be alcohol excess, things for us to take note of. So going to the meat of it as I begin to round off, by and large, again, the important thing here for me is we need to try and prevent stress. Very important. We need to identify it early and find ways of getting ourselves away from it. Somebody to ask me a question and say, well, I was born black. How do I change that? You can't. But there are certain things that are stressful. For example, if you're in a job or if you're in an environment where the stress is ongoing, it may well be that you need to extricate yourself. You need to remove yourself from that environment in order to prevent stress from happening. I remember counseling a young lady with my other hat as a pastor of a local church, and she was involved. She was involved in a very toxic relationship with a guy, nice guy, with all intents and purposes. But the relationship was very toxic. Why? Because the young man was damaged. The young man had mental health issues, had been abused as a child, and began to transpose everything on this young lady. And this young lady was so distressed that she needed mental health attention. She needed mental health medication, which the bottom line of what I'm saying, I tried to tell her, look, you need to get away from that relationship. You need to go take just a break. You don't need to break off the relationship completely. I'm just saying, take a step away from that stressful relationship. Sadly, she didn't listen to me. She ended up getting worse and worse and worse. You know what I always humorously say to my patients is that only my mother does everything I tell her to do. And so you're not obliged to do everything that we tell you to, but we are health professionals and we do give advice for your own good. So in terms of stress prevention, you cannot overemphasize the role of good sleep, a healthy diet, These are the lifestyle changes that you and I can make. These are things that you can get a grip of by yourself. Exercise is a very good one. There are certain types of cholesterol that will never become better unless you exercise, or of course, unless you want to take drugs, in which case medication is fine. But in terms of how you deal with it yourself, exercise increases your HDL cholesterol, the good cholesterol, and it makes it better. So just to give us an idea, because there are certain people who want to cheat the system. You want to live a healthier lifestyle, but you don't want to. You want to live healthy, but you don't want to exercise. You want to live healthy, but you don't want to have a good diet. It ain't gonna work. I'm sorry to be the one to break it to you. All right. Number 3, a good work-life balance. Learning to say no. I learned from a management course many years ago that every time you say yes to something, you're saying no to something else. So learn to say no, and every time you say no to something, you're actually saying yes to something else. I remember turning down a speaking engagement because I had promised my son that I was going to take him out and watch a movie. We had a father-son date, and so I turned down a very nice speaking engagement. And I work hard. There has to be a balance somewhere. There has to be a balance. I'm just telling you the choices that I have had to make. But work-life balance is really, really important. Learn to work hard, but also play hard. Take your holidays. Afro-Caribbeans are not very good at taking holidays. When I was younger, and I've been guilty of it, that's how I know. When I was younger, holiday was another opportunity to make extra money and work overtime. That was my thinking. That was my mentality. But I had to repent, and I had to change my mind and do better. So, like we mentioned, number 4, good human relationships, not holding on to grudges, having a good support network. I always say this, that human beings were created to be in a circle of people, who were created to be among people. So if you find yourself isolated, isolation on its own is a stress factor, and that can lead us into depression. That can cause, problems for us. Having a good positive self-image, relaxed mental attitude, having good emotional intelligence is very important. How do we cure it? What are the things that we can do? We can talking therapies. We can go into medication. In terms of depression, which is going to be similar to stress itself, there's self-guided help, psychoeducational groups, again, talking therapy, CBT, applied relaxation. Of course, medication is a big one. There are loads of medication that help to bring anxiety and stress down, and your medical professionals will be telling you there's a whole myriad of them, depending on your individual response. Obviously, complementary therapies. This is not actually available yet on the NHS, and because it's a new area of research. When I mean new, it's only been in the last sort of 10 years or so that people are now talking about mindfulness, yoga, hypnotherapy. I've seen some good efficacy. I personally, in my practice, I've seen people respond well to these things, but always I found out that it's a combination of this as well as other therapies that tend to work better. So that's my little spiel for today. Just a quick one regarding prolonged stress and how it affects us mentally, in particular, how it leads to depression. Thank you. Any questions, please put it in the chat box.
Great. Thank you very much, Dr. Joe. It has been insightful, and I've seen a couple of emails and requests for the slides. So for those who want copies of the slides, please drop us an email, health@cahn.org.uk. But also the session has been live streamed onto YouTube and Facebook. So if you go to CAHN's YouTube page, you will see that over there. So Dr. Joe, a number of questions for you, and I hope I can do good justice. So the first one is, I'm 19 years old and take fluoxetine for depression. Yeah. However, my hair has started to fall off. Could this be due to the medication?
That's a really good question. The simple answer is yes, it could be. But if you're 19, and especially if you're female, then we would need to investigate other more likely causes of it. So lack of vitamin D is a very common reason why people lose their hair. A lot of people don't know that. As you can see, until yesterday or so, we don't have a lot of sun in Manchester, in Greater Manchester. So, and 80% of our vitamin D comes from the sun. So I would say yes, but you need to explore, check your iron, go to your doctor and check your iron levels and ask them to check your vitamin D levels. And you will find out that you may well be deficient in one of them, and that's a more likely reason. Or it could just be alopecia. So it needs to be investigated further. Thank you.
Great. Thanks, Dr. Joe. I know you touched on high blood pressure. Someone is asking, I have high blood pressure, and although I take my medication, my stress and anxiety levels are so chronic that my blood pressure is still not well controlled. What can I do?
Very good question. I have quite a number of patients like yourself who have high blood pressure and they're struggling to control the high blood pressure. So what I tend to do is not just give you medication, but then we introduce you to other talking therapies like cognitive behavior therapy, mindfulness. You need to find a way to relax in order for those blood pressure tablets to be effective. And so this is where complementary health and other allied health professionals come in. Go to a good CBT therapist. You can be referred through your GP. You can do a self-referral. We in CAHN, we have a very good counseling unit that you can come to for free of charge. So there's loads of opportunity, but you need something else in addition to medication. That's what it's telling me. And then it may well be that your blood pressure tablets need to be tweaked. You know, for example, speaking about blood pressure, some research was done many years ago, interestingly pioneered by one of my teachers who is no longer with us. The way the kidneys of Afro-Caribbean people react to blood pressure tablets is different to the Caucasian kidney. And so there's a particular type of tablet called angiotensin converting enzyme inhibitors, which are more effective in Afro-Caribbean people. And so you may just need to change your medication to a more agreeable medication in order for that to happen. I don't know what your particular circumstances are, but those are the likely things that we need to look into to make sure that that blood pressure is well controlled.
Great. Thanks, Dr. Joe. There's a question from Facebook, someone who has been diagnosed as pre-diabetic and asking how, she could reverse that.
Very good. So pre-diabetes means that your HbA1c readings are between 41 and 48. In other words, you're not yet diabetic, but it's not particularly normal. What I often say to my patients is that means you're 1 or 2 clicks away from becoming diabetic. So what you and I can do is to change your lifestyle. You have to change everything. You have to change your diet. You have to change, you have to start exercising. Research has been shown, this is proven, that even people who are already diagnosed with diabetes, losing 10% of their body weight can reverse diabetes. There's ongoing research with hypertension. It's not quite conclusive yet. In fact, I attended a course in December. We were still talking about this in London at the Excel. There's research to show that losing weight up to 10% as well may well have an impact on your blood pressure, but it's not yet concluded. But for diabetes, it's very clear. So for that person, pre-diabetes is fine, but you need to modify your diet, you need to modify your lifestyle, you need to start exercising more.
Great, thanks for that, Dr. Joe. And you talked about reading, and I'm sure there are some lay people here. So how does the process work? What is measured? What is looked out for?
You mean in terms of pre-diabetes? Or?
Yes. Yeah.
Okay. So the HbA1c is a blood test. It's a blood test that measures what's been happening to your blood sugars for the last 3 months. That's very important to know. It's not a measure of what's happening to you now. That's why we like to use it, because it measures what's been happening to you in the last 3 months. The magic number is 48. If you get a number above 48 twice, you're automatically diagnosed as being diabetic in the UK. The numbers are slightly different in Canada and in the US. It all depends on which lab you use, all right? Now, anywhere between 41 and 48 puts you in the region of pre-diabetes. That means it's no longer normal, but you're 1 click away from being diabetic. And that is totally reversible, 110%. So the fact that you're pre-diabetic, it doesn't mean you have to go on medication for diabetes. It doesn't mean you have to take any specific drug, but it does mean that you have to modify your lifestyle in order for that process to change. Anything below 41 is considered to be normal.
Great, thanks, Dr. Joe. I've learned something, the magic number 48. Right, so someone is asking, how best can someone reduce the impact of stress when you work in a physically demanding job environment?
Okay, so physically demanding environment, it's the same thing as a mentally challenging environment. You have to learn how to switch off and de-stress. All right, whatever works for you. So I'll give you an example in my own life. My job is not particularly physically demanding, but it's very mentally challenging. So what I do is I listen to a lot of music. I read books. In fact, I watch movies and things to help me de-stress. Whatever is going to work for you. Sometimes I go for a run. All right. But if you are finding out that whatever you're doing on a day-to-day basis is increasing your stress, what it simply means that when you are not working, you have to make sure that you are able to climb way back down and de-stress and really proper unwind. Or the alternative is to find ways of getting into another job that's not as physically demanding. But what I also found out is this: if you are having problems with a physical demand, are you exercising? Are you working those muscles properly? Many years ago, I developed back pain in my job as an A&E doctor. I was an A&E doctor for 4 or 5 years, and we used to stand for long periods of time. And I went to my consultant and said, I've got back pain. He said, when was the last time you exercised? It's been 2 years since I've done any prop. So I started exercising and my back pain went. I'm just giving an example. Yours may not be as simple as that, but exercising your body actually helps you to be able to cope well physically. I hope that helps.
Great, thanks, Doc. My friend has just been diagnosed and currently had successful breast cancer treatment, but I'm so concerned that about the cancer coming back. Can prolonged stress cause the cancer to come back?
That's a tricky question. Prolonged stress will not cause it, but prolonged stress can hasten it. Like we outlined earlier on, prolonged stress can decrease our immunity. So it can affect your immune system. So if I'm going to be brutally honest, the simple answer is yes. If you are stressed out, then you are more susceptible to infections, including cancer. So, and that's just the truth. So, but it's not a direct relationship. It has to be the roundabout way in which it does that. But prolonged stress can do a lot of things, unfortunately. And so that's why I was really emphasizing today that we all need to be very, very careful, especially if you're over the age of 35. You know, even in young children or younger people. It's less in younger people because their cardiovascular system can take it. But as you grow older, your cardiovascular system can no longer cope as much. And so you have to be more careful as you grow older that you don't allow yourself to get exposed to prolonged stress.
Okay, thanks, Doc. I'm always in low mood. Because of that, I find it hard to sleep. What should I do?
Always in low mood, and so finding it difficult to sleep. The low mood needs to be explored, because if you have found the cause of your lack of sleep, then we need to explore, why are you always in a low mood? What can we do to treat that or deal with that? And then perhaps that would help you sleep. Obviously, there are a number of things you can try, over-the-counter agents that will help you sleep. But that, again, the low mood itself needs to be explored and dealt with. Because when people come to me with insomnia, for example, that lack of sleep, I often say to them that we need to try and find why you are not sleeping. There are some people, and there are not many, who have true insomnia, where there is absolutely no reason whatsoever. But most of us, there's an underlying cause to your lack of sleep. Either you're worrying too much or low mood like this person, or something else. Once you treat the underlying cause of that, the sleep will automatically fall into place. There's medication and things for that as well, and you can get help from your GP.
Thank you. What advice would you give to women who are on antidepressants, but then they stop suddenly as soon as they find out that they are pregnant, for the fear that the antidepressants will affect their babies?
So with regards to pregnancy and antidepressants, it's a case of risk versus benefit. If I think stopping your antidepressant is going to make you worse mentally, an unhealthy mom means an unhealthy babies. So by and large, unless it's going to really, really affect you. Yes, if we know it's planned, we can stop it gradually before you get pregnant, or if you find out, that's fine. Stopping it suddenly is not an issue. You may have some side effect, but once you cross your first trimester, after the first 3 months or so, 12 weeks, we often bring you back for a review with a view to possibly starting you on the medication. If you are well in yourself and you don't need the medication, or you can cope, then happy days. We don't put you on the medication. So it's a win-win. All I'm saying is that if they stop suddenly, that's fine. That's great. And if they're able to cope, but if they're not coping well, there is a scope for putting them back on the antidepressants.
Great, thanks, Dr. Joe. So this is not a question, it's more of a comment. Having suffered previously from work-related stress caused by the pressure of being a Black CEO, Black chief exec in a wide world, it resulted in being diagnosed with high blood pressure. I explored and now very much committed to mindfulness and meditation. So really glad that Dr. Joe mentioned that.
Yeah, I agree completely. I mean, you know, it's tough whether you're Black or white. It's tough being a CEO, period. Anybody who's been in any position of leadership will know that. So this is an important thing that I teach in some of my leadership courses that I teach on. Once you get into a position of leadership or you're any kind of leader, you have to be more careful and you have to take more care. This is why today I'm emphasizing more on prevention. Because once stress sets in, like this person has already highlighted, it can then lead to high blood pressure and other undesirable things which we don't really need. Whatever the causative agent is, whether it is racism, whether it is pressure from work, whether it is unrealistic goals, you have to take measures early. Try to take measures early. Not always easy, but try to take measures early to identify those stressful factors and to remove yourself or to There are people who I've had to sign them off. I remember, I'll give you an example of the lovely guy, head teacher, Caucasian, lovely gentleman, only in his early 40s. But there was so much pressure on him to perform in the school, and he had done a good job in the school, turned it around, school was doing better, but he was under so much pressure that I personally signed him off. I forced him, I said, look, no, not forced, but I encouraged him. I said, look, take time off work. Took time off work for a month, 6 weeks. School was very supportive, and he went back, and he went back and became better. So there are certain things that we need to try and look after ourselves a little bit more and identify those pointers when it starts coming our way.
So Dr. Joe, you're saying having time off and holiday is not necessarily a sign of weakness?
No, not at all. It's absolutely a necessity. One of my senior colleagues who is now retired, he taught me something. And in our job, I don't know what other people's jobs are, but my job can be quite demanding, all right, in many different ways. Every 8 weeks, this is what he has been doing. And he worked as a GP for 32 years before he retired, or longer even. He worked as a doctor for 40 years, a GP for 32 years. Every 8 weeks, he would take some kind of a mini break. Even if it's just 2 days in Wales. Doesn't have to be something exotic or esoteric or expensive. 2 days in Wales, 2 days in the Lake District, where he goes and switches off and he's reading a book. No tablets, phone, or anything like that. I know another consultant who would go to some island in Scotland for 1 week or once or twice a year and just disappear for a week. So it's not in fact, every good general, if you read widely like I do, every good general knows when to retreat. It's only the foolhardy general that continues to advance. So definitely not, it's actually a sign of emotional intelligence to know when to take a step back, recharge, refire, recalibrate, and then move forward. Absolutely important.
Great, thanks, Dr. Joe. Another important question. What is the connection between thyroid and depression?
That's a good question. So like I highlighted, an underactive thyroid, for example, is a differential diagnosis. It's one of the things that can mimic depression because they have the same sort of symptoms. So you can have tiredness in both underactive thyroid and depression. You can have dry skin. You can have reduced libido. You can have weight gain in both of them. A thyroid disease does not cause depression, but it can give you symptoms like depression. So many people have been wrongly diagnosed as being depressed whilst they were just had an underactive thyroid. I remember, I think I shared this. I'm going to be doing a video on this actually. There's a case study of where was he from? He was somewhere from Africa somewhere. I can't remember now. But he was diagnosed as being depressed, and he was being given antidepressants, and it wasn't working. So all we did was I saw him, and we did a gamut of tests, and it came back that he had an underactive thyroid, amongst a few other things. He was low in B12 as well. And immediately we started him on thyroid treatment. Bang, he became better. And so it's one of those things that can mimic depression or can behave like depression, but they're not related in that sense. Thyroid does not cause depression. Depression does not cause thyroid, but they can have similar symptoms.
Great, thanks, Dr. Joe. Look forward to that video. I've been feeling pains and swollenness in my feet for a while. What do I need to do?
Sorry, you've been feeling pains and
yes, and swollenness in the feet.
Okay, well, it's great. I don't like answering clinical questions in this forum, but I'll make an exception because we need to look into greater detail as to why you're having swollen feet. Are you on medication? Blood pressure tablets can give you swollen feet. Are you overweight? Do you exercise? There's a lot of things that can cause that. So really you need to be speaking to a physician, having an examination if necessary, and maybe even having some blood tests. It's not simple, not a simple cut and paste.
Thanks, Dr. Joe. Whilst you're talking about not being, simplistic, a listener on YouTube is asking you to repeat blood pressure medication. And I know that the name you mentioned, and I know you'll be saying first and foremost, seek your GP's, advice. But,
yeah. What was the specific question regarding?
Also, so can you repeat the name of the blood pressure medication you mentioned?
Okay, so by and large, with Afro-Caribbean, it's actually the NICE guidelines, the National Institute of Clinical Excellence. If you are under 55, all right, if you're under 55 and you are Caucasian, you're more likely you're gonna need to get something called amlodipine. If you are over 55 or you're Black, then you need to use something called an ACE inhibitor. Ramipril is one of them. There's lots of them, but it's the name of the tablet is Ramipril, and that's the one that would suit Afro-Caribbeans better than the other one, than the amlodipine, than the first choice one. But you obviously need to speak to your GP and get more clarification, because obviously everyone's circumstance is different. You may have a side effect to certain medication, and you need to be careful around that. But there are ACE inhibitors. One of them is Ramipril, just a trade name for one of them.
Right, thanks, Doc. Another helpful comment from a fellow doctor saying, she wishes doctors back in Nigeria will listen to your presentation. So that's a positive one.
I've been on Nigerian TV a few times actually. So yeah, I'm always happy. If you have links to that, I'll be happy to chat. I'm always happy to chat. But thank you for the kind words.
Great. So what's the effect of stress on palpitations?
So palpitations is one of the physical manifestations of stress and anxiety, and for those of us who may not be aware, palpitations is defined as conscious, fast, and sometimes painful beating of the heart. Notice, as we're all sat here now, our hearts are beating, but we're not aware of it. So when you have palpitations, it means there's a consciousness, you're aware, your heart is pumping, you can feel it, you can hear it almost sometimes. There's a conscious, fast beating of the heart, and sometimes can be painful. So stress and anxiety often manifest physically in forms of palpitations. In one of my previous talks, we talked about the somatic or the physical symptoms that you get from stress and anxiety. One of them is palpitations, and one of them is chest pain. You can have pins and needles in your hands. You can even have tiredness, you can have shortness of breath, fast breathing. So all these are physical manifestations of stress and anxiety.
Right, thanks, Doc. Yeah, the person that asked the question about the swelling in the feet is asking whether that's a symptom of diabetes.
It can be, but it's more likely to be related to your blood pressure or to your kidneys, or indeed to your weight. It could be one of a number of things. Diabetics can have it. but it's more, anybody who has swollen feet, it's either musculoskeletal, that is just your muscles and your nerves. It could be related to your kidneys. It could be related to high blood pressure. Indeed, it could be a side effect of medication. So you can see that even traveling on a long distance flight can cause you to have swollen feet. So it's not, we have to explore your symptoms a little bit more. And, while I'm on this, while we love to answer questions, don't turn this into a consultation. I'm always happy to chat to people if and when we have time. So I saw in the chat, somebody was asking for my details. If you get in touch with Charles or with Elizabeth or with Ngozi, our communications person, they will link you up with us. We're always happy to chat to you. But what is really important is that as a community, that we are looking after ourselves more and taking advantage of this health talk so we can get the maximum from it. The aim is not to deal with every single query. I often shy away from specific queries because that's not the idea here. So even though as much as we like to help, but it's really important for us to be aware of that.
Thanks, Dr. Joe. So what Dr. Joe is saying is please make sure you have a GP, make sure you have a relationship with your GP, and more than happy for you to come here for second opinion, but also you can drop an email. And one of the commitments we have from all the GPs and consultants who present is that one-to-one free consultation as a way of giving a second opinion rather than being the first point of call. So that's really important and worth emphasizing. Another question, I have underactive thyroid and always feel tired. What can I do to increase my energy levels?
You need to take medication. You need to change your medication. Your medication needs to be reviewed in the first instance. If you're proven to have an underactive thyroid, there's medication for that. So the first thing I would do is to go for a medication review with your GP. You might not be on the right dose. And sometimes we need to change the doses a few times in order to find the right dose for you. So that would be the first thing. Also, if you're always feeling tired, like I mentioned previously to the 19-year-old who's having low mood all the time, there might be something else that you're deficient in. If you're deficient in B12 or you're deficient in vitamin D, for example, you will feel tired. And so those things need to be checked as well as your thyroid in order for us to be sure that it's not just your thyroid that's causing the problem.
Great. Another question, how long is it okay to be pre-diabetic?
Well, that's a very interesting question. How long is it okay to be pre-diabetic? You can be pre-diabetic as long as you want. That's not the issue. The problem is the longer you are pre-diabetic, the more likely you are to become diabetic. So that's just the rule of thumb. And it varies for everybody. I know patients who have been pre-diabetic for 10, 12, 15 years. It never grows worse. Well, unfortunately, it doesn't also grow better. It's not a problem. It doesn't cause them any harm. It doesn't do them any problems. We don't give them any medication for it. But we keep on emphasizing, like, those are the ones that we bring out yearly. They have a yearly recall. So that what I would advise you to do if you are pre-diabetic is to go to your GP and institute some kind of yearly recall with them so that we can keep an eye on the diabetes and make sure that pre-diabetes and make sure that it's not progressing further.
Great. I have been suffering with depression since 2009, and I've tried many different medications. They would give me initial response and then steady deterioration. So now the diagnosis is resistant depression. I've been denied talking therapy despite making many attempts because the problem has been long-term. How can I get therapy I need on the NHS?
Okay, so I think this will largely depend on where you live and where exactly your patch, which generally speaking, I don't know why anybody would be denied therapy for any reason. So I would suggest that you look closer into that. Get your GP. If I was your GP, I would be writing to the CCG, the Clinical Commissioning Group, and asking them why this person has been denied therapy. I would be doing that on behalf of my patient. I have done in the past, and I would be doing that. So go to your GP and get support from your GP. That's what we're there for. So there's no reason why you should be denied talking therapies. To answer your initial question, all the research suggests that medication itself is good. Talking therapies on its own are good, but the combination of the two are far more effective. So this is why, especially within the Afro-Caribbean community, I don't like the idea of shoo-shooing therapy or shoo-shooing counseling. And it's very important that we combine the two. What, for example, cognitive behavior therapy does, it gives us coping strategies, coping mechanisms of how to prevent further relapses of depression. So while tablets are good for the here and now, talking therapies are actually good for preventing recurrences. So I think it's really important. If you were to go private, which is an option, it can be quite expensive, but not so much so. I know providers who provide up to 10 therapy sessions for about £250. And I also know that, again, with CAHN, we do have therapists here that you can access free of charge. If the NHS is one of the reasons why CAHN has been set up, to bridge the gap between all the different health inequalities that we experience. And we are pleased to say that we do have a vibrant and functioning counseling unit that can offer you help should you need to, free of charge to you.
Great, thanks, Dr. Joe. I went to my GP with symptoms of postnatal depression, and the first thing my GP did was to put me on antidepressants. I was really unhappy with this form of treatment, and therefore I did not take my tablets. I did not know where to turn to other than my pastor, who prayed and said, "It's all in my mind," which was unhelpful. I need support. What do I do?
I'm sorry I'm laughing because I'm a pastor and I would never do that. But hey, people operate at the level of knowledge that they work in. Now, I think if it depends on what level of risk you presented to your GP. Postnatal depression is very serious. People have killed their own children because of postnatal depression. Postnatal depression is one of the major red flags that we are very quick to jump on it and to do something about it, because now not only is your health at risk, but now you have the possibility of a young baby or even other children being at risk. So depending on your risk assessment that you give to your GP on that day, I would probably do exactly the same. If you came to me and I considered you to be high risk, I would give you medication because you need to be taken away, you need to be helped to deal with that current situation so that that situation does not escalate to the point of you causing harm to yourself or to your children. So where other people are involved, we are quick to take action. So your GP or your health professional probably have been right in giving you medication because it's a really important thing that needs to be dealt with quickly. I would be happy to chat to you. This is one person I will make an exception for. If you get in contact with our lovely people in CAHN, I will be happy to chat to you if you so choose to, and we can arrange an appointment. We can do a video call, and we can talk about it if you want to.
Thanks, Dr. Joe. And I must declare that I will not say to someone, yes, don't have your medication and just rely on prayer. We've seen so many fatalities in our community. And, once again, having your medication is not a sign of having low faith or doubting that God can do miracles. So it's really important we get that straight. Another question: it's been difficult to carry out full body MOT in the present COVID. And getting an appointment is usually via video. Can we have a list of other private consultants where we can carry that out? And is that affordable? So that's a question. But I'm sure now as things are opening up, then there could be opportunities. But Dr. Joe, any comments?
Well, it is. So GP access is difficult nationwide. There's no doubt about that. People are waiting longer. It's more difficult to get into your GP. But practices have been open for business, including full body MOTs since January last year. So please insist, go to your GP. There are private providers. You can go to Pall Mall in City Center. You can go to, what do they call them? Spire. You can go to Bupa, but they're not cheap, all right? They're not cheap at all. And I wouldn't recommend that, to be honest. The NHS is available. If you find that, and I hate saying this, but if you find that your GP practice is not meeting your need, I've had to say to a few people, change your GP, go somewhere else. You're not tied, you're not bound by the hip to them. But practices, our practice has been open for a long time. So, I don't know why that's not the case. We've been doing health checks and things, and my practice in Rochdale, where the sun is always shining. So it's I think it's very individualized, and it's sad that that's the case. But please do persist, and make sure that you find out more information. But don't go private; it's quite expensive, unless, of course, you have the money. And if you have the money, that's fine, But if you just Google it, there's lots of private GP practices in and around Manchester City that you can access. We are not obliged, I wouldn't encourage CAHN to provide you with a list of anything, because it will be against competition laws to do that. So you would need to find that out yourself if you wanted to. Talk to your friends. Google is your friend in this case. If you came to me, for example, and you had a private consultation with me, I can tell you, but we wouldn't tell you as CAHN that this is where you should go to, because it's your responsibility to do that. The NHS is big enough, strong enough to accommodate everybody's needs, and I think you should try that as a first avenue.
Great, thanks. So another comment, and it's from Christine, who is one of the leads in midwifery at University of Manchester. So refreshing to listen to sound advice. We need more of this. Thanks for the positive comment, Christine. Another positive one from Sedi, and Sedi's had to sign off, but Sedi is the chair designate for Kent and Medway Integrated Care System. So great to have Sedi's support as always. Another question, can you reiterate the type of medication for high blood pressure and also bulk PPL with kidney issues? Oh, okay. Well,
Bulk what? Sorry, I didn't get that. Bulk?
PPL with kidney issues.
What is PPL?
I don't have a clue.
Okay, so it's going to be difficult for us to answer your question if we don't quite know what it is. I would suggest that you refrain from abbreviations, which may not be universal. Black people, somebody says. Oh, black people and blood pressure tablets. So what I was trying to say is that a long time ago, some research was done about angiotensin converting enzyme inhibitors. So ACE inhibitors, which are a form of blood pressure tablets. They are far more effective in Afro-Caribbean people. And so that would be the first line of use. So that's generally what we tend to prefer. And there's a number of ACE inhibitors. There's captopril, there's ramipril, etc. So I would, again, go to your GP, because this kind of discussion needs continuity. I could tell you one thing today, but the story doesn't end here. There's more discussions that need to be had. We need to check your BMI. We need to check for allergies, because, for example, those ACE inhibitors they have their own side effects as well. They can cause angioedema, which is facial swelling. They can cause leg swelling. So there's a few things. Medicine is not straightforward. It's not as simple as a lot of times people think. A few things need to be explored so that we can actually know what's right for you. Is that okay? I have to go in the next couple of minutes, Charles.
Yeah.
So,
we're sort of wrapping up, and I think the last one that there's always a long waiting list for talking therapies. Yes. How do we then deal with depression? Instead of relying on medication. And another question linked to that: how do we? Are there any herbal remedies for relaxation, or that could help with relaxation rather than solely depending on medication?
Carrot cake is a good herbal remedy for relaxation. It works for me all the time, especially the ones that have raisins in it and with a strawberry layer. No, I'm kidding. So by and large, I can't comment on herbal remedies simply because we don't know what's in it. So I don't advocate for you to use herbal remedies as a first line, unless you can be sure of what's inside it. Because different people, I know Holland and Barrett is good and a few other providers are good, but unless you can be sure of what's actually in it, I wouldn't recommend that you use it. And as an NHS doctor, we don't recommend herbal remedies, period. Now, in terms of lowering your blood pressure and stress, how to relieve stress, there are medications and things that you can do. There is mindfulness and other things, yoga, exercise, a lot of other things that you can do to help with that.
Thanks, Dr. Joe. For those who live in Greater Manchester, since this is national and we have a national audience, we just about to start a health and well-being choir. So, and also another big thing which is up and down the country as part of the agenda is also, on social prescribing, and like Dr. Joe is saying, joining a gardening group and other things. We've spoken a lot about stress in adults, and I've heard a lot of children saying they're stressed due to COVID and the exams expectations. What can we do to help children that are stressed?
Yeah, that's a really good question, but I think we didn't answer the issue about waiting time for therapists. Now, there is a long waiting time for therapists, and it's a national problem everywhere within the UK. Some places worse than others. Two things that you can do. Obviously, you can go to your GP, and I know it's easier said than done getting an appointment, but you can go to your GP. But also, I've said here before, there are organizations, including CAHN, that provide free mental health services within your locality. I would encourage you to look for them and get in touch. I've been partnering with a few lovely guys. There's 42nd Street in Greater Manchester, our own CAHN, we have a counseling unit. There's lots of different options of places that you can go to if you check. And so it's really important that don't suffer in silence. Worst case scenario, get in touch with us in CAHN. We will signpost you if we are not able to meet your need. But we have a full-fledged counseling unit that we can attend to you with. That's actually one of the reasons why CAHN was set up, to bridge that gap in that health inequality, because we saw the need out there and we're trying to see what we can do within our own community to help ourselves. So please take advantage of that. So going back to the issue of children, right? This is a difficult one because, like I said, I think with children, first of all, you need to be able to identify what the issues are. And there's a whole session that needs to be I think we need to designate a whole session to that, to talk about mental health in children, how to identify it. And I think one of my colleagues may have already done something along CAMS and things like, unless I'm mistaken. Or
we're hoping either the 3rd or 4th, Saturday in April will be on CAMS.
Okay, fine. So please hold that thought and bring that question there, because time will not permit for me to thoroughly deal with that question, because it's a very important and a very interesting concept.
Right. So in sort of wrapping up, and I know there are so many other questions we've not been able to deal with, and we will try and share those questions with Dr. Joe to answer. So please drop us your email and then we will, send you those responses. But the final one, I have chest pains, nosebleeds. I have had many investigations and we're all clear. And I've been prescribed statin and aspirin as a prevention.
What's the question in there?
Well, I've had chest pains, nosebleeds. I've had many investigations that were all clear. Test noted I have plaque in the organ. So therefore, GP prescribed statin.
I don't think that's the full story. And I would encourage us not to bring blatantly clinical questions to this forum, because it will be difficult for us to actually answer your question without doing a full, taking a full history, that's taking a full, finding out what's going on and then examining you. So my apologies that we will not be able to deal with that question, because we need to ask some more questions in order to be able to help with that.
Great. So thanks everyone for your time. Next week, we're going to be focused on psychosis and schizophrenia. So please make time to be here. Is the same link, the same Zoom ID or Facebook and YouTube. So please download the various flyers and information. Also, the helpline for CAHN is in the chat box, 077 100 22382, and you would receive free support. At this point in time, I'm going to hand over to Percy, who is our business development and impact manager, to close us. But once again, thanks, and it's great to see Angela and other CATHIP partners who up and down the country we're all working collectively to make sure that we can improve the general health and well-being and the health outcomes within the Caribbean and African community. So please spread the word. Don't keep it to yourself. Share the knowledge and invite your friends and loved ones. Over to you, Percy.
All right, thanks so much, Charles. Thanks so much for the introduction. Just to say a big thank you to Dr. Joe. Thanks so much for that presentation. Very, very useful, and it was very brilliant, really. I mean, stress is something that we often take lightly amongst our population. So there's over time that we just see it as one of those things that happens and a part of life. So special thanks to you, Dr. Joe. And to all our partners, as Charles has said, the Black Health Initiative, the Royal Assembly Redeemed Christian Church of God, we've got RAFA International Development Agency, Croydon BME, and also MFID Caribbean Association. So thanks so much for your contributions to the program and also for pushing it week in, week out. So a special thank you to us. And a real to you, and also like a big thank you to the viewers for joining in today. So on Zoom, on YouTube, on Facebook, wherever you've joined in, special thank you to you. We look forward to seeing you again next week as well. And like we rightly said throughout the program, the slides are available. The links to the videos are also available. My colleagues are putting them in the chat box, like I've already seen as well. They're going out as well. So that's good. So please do drop us a mail at help@cahn.org.uk and we'll be able to pick up your request. So please do that. Then just to point out a couple of events we've got that are coming up. So this week, we've got our Healthy Hearts program coming up. So that's going to be on Tuesday. It's going to be from 5:30 up until 6:30. So do try and join in. Still, it will be maintaining the same theme that Dr. Joe has covered on today, and we'll be looking at food and stress. So try and join into that. Then we'll also be having a bid writing workshop. That's just basically to teach us ways to assess public grants and all that. So that will be on the 7th of April. So it's really useful learning to take from there. So do have that one in your calendar. Then moving on to much later in the month, really, we've got from one of our partners also one Manchester housing event. So that will be on the 26th of April. So that's going to teach us and just to educate us basically on how to go about housing pathways and then in owning your own homes over time. So please, we look forward to you joining us on that. And just to touch on before we go, the Windrush, so we know how important that is for us. We at CAHN, we're having a Windrush Day event that will be coming up in June. So we look forward to having you join up on that with us. As we build up to it, there'll be more information as to regarding how to sign up. It will be a physical event. It will be at Alexandra Park in Manchester. So we look forward to having you there. Then from also one of our partners, we've got a book launch that's going to be happening, and it's still on the Windrush as well. So it's titled 20 Stories of Determination and Triumph. So it's about stories that people did share about their Windrush. So we look forward to you joining in that as well. So just to say a big thank you for joining us today. And as usual, please, we've got the services available. Like Charles and Dr. Joe have mentioned throughout the program. We've got our counseling service, we've got our family and advocacy service, and we also run a suicide campaign as well. So please get in touch with us and we would be able to pick up your needs, and we'll try, even if we can do it ourselves, we'll be able to signpost you. So please, these services are available to everyone in the community and they are free for all. So just take out your time, and then please, if you have anyone that has needs or that needs referral, please signpost them on here and we're able to help with their needs. Yeah, so thank you so much. We look forward to seeing you next week. I think the sun is out, so do enjoy the rest of your weekend and have a good one. Bye for now.
Great. Thanks, Percy. So just to say to everyone, please make sure you can visit the websites of our partners, RAFA, Black Health Initiative, Croydon BME Network, find out what is happening, where you live locally and stay connected. Thank you.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks Topics will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@CAHN.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.